This conference will now be recorded.
Excellent. Thank you so much. Alrighty. Happy Thursday, everyone. I'd like to call the Social Connectedness Task Force to order at 11:37 a.m. Roll call, please.
Commissioner Nelson?
Here.
Commissioner Loops?
Here.
Commissioner Cowell?
Here.
Madam Chair, you have a quorum.
Excellent. Thank you so much. Moving on to approval of the minutes. Are there any corrections to the minutes of the previous meeting? See none. Can I get a motion to approve the minutes?
So moved.
Motion by Commissioner Loop, support by Commissioner Kowal. Thank you. All those in favor signify by saying aye. Aye.
Aye.
Aye.
Opposed? Excellent. Motion carried. Alrighty, next up, I'm going to move on to the approval of the agenda. Are there any changes or corrections for the any of the agenda items? Excellent. Seeing none, can I get a motion to approve the agenda?
I move to approve the agenda.
Moved by Commissioner Loops.
Support.
Thank you, Commissioner Kowal. Support by Commissioner Kowal. All those in favor signify by saying aye.
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 Opposed? Alrighty, excellent. Motion carried. Next up, I'd like to move on to public comment. Is there anyone from the public who would like to address the Social Connectedness Task Force?
Currently, there are no callers on the public comment line, and there are no online submissions.
Excellent. Thank you so much. See none, I will close public comment.
Mm-hmm.
Alrighty, next up, we'll move on to our regular agenda. We've got 3 agenda items. Let's see. Alrighty, our first agenda item, number 1, countywide mailer with resources and services available to seniors. Barbara? I can talk on it before we approve it, right?
Yeah, but first motion and support.
Oh, thank you.
The representative Manugian is trying to get in on, I tried to send her the link, sorry.
I got you, no problem. Motion by Commissioner Loops. Support Commissioner Kowal. Awesome.
Now we can discuss.
Okay, thank you. So agenda item number 1 is in regards to some previous discussions that we've had here on this task force in regards to looking at ways that we can increase the awareness of some of the supports that are actively happening throughout Oakland County from a local level, and also from a lot of the things that are happening at the state level in regards to those kinds of resources. And we're going to be working hand in hand with AAA 1B in regards to putting that content together. But I wanted to take an opportunity just briefly during this meeting today to get any feedback or insight on any essential pieces of information or resources that you would like to see on these mailers. The idea also too is to be able to send these direct mailers to every single senior in Oakland County age 60 and up. On the screen right now, this is the resolution that was drafted. Barbara, can we make it bigger by chance so everyone can see it in a glance? Or I don't know if people are having trouble reading it or seeing it, please let us know. I might not be able to see you on the screen. So just pipe in, take your mic off of mute. So basically what this resolution is stating is that up to $120,000 from the CARES Act Coronavirus Fund, Relief Fund, is going to be put forth to create these mailers to send to seniors across Oakland County. Like I said, we're going to be working with AAA 1B in regards to content, and in addition with a graphic designer. I think let's just have you guys look through, read, and then what we can do is talk a little bit about some of the resources and information that you have any suggestions on being on those mailers.
Commissioner Nelson,
Yeah.
this is Kathy. I'm really apologizing because I can't get into my computer today to take a look at it. And
no.
I just wanted to be sure that Nurse on Call and the Oakland County Health Division has a resource page for seniors as well, that would be included as a link or something.
Excellent. And what was that second one, Kathy? You said Nurse on Call and?
We have built a senior resource page over the years, and we've worked really hard with AAA1B in the past and our Senior Advisory Council to compile lots and lots of senior resources. So I can't get into my computer to make sure that it's still there, but it has been a really valuable resource. So I'd like to see a link included to that.
Excellent. I love that suggestion and that feedback because for those seniors that do have internet accessibility and those technology devices to get online and to look at those resources, I absolutely love that suggestion. Thank you so much, Kathy. Does anyone else, or Kathy, do you have any additional?
So Nurse on Call, they are, for years they have been the senior resource, and they navigate people through that don't have computers, as well as they have a really robust system for sending people resources from Nurse on Call.
Excellent. Thank you. And one of the things,
Madam Chair, I can't read the whole resolution here as it's displayed on the screen.
Thank you, Commissioner.
Can you please scroll down? Okay.
I just want to point out it's a draft only. I didn't put the watermark on it yet. Everything is up to discretion, and if it would help, I can send it to the whole group, those two resolutions.
Yes, please.
Okay.
That would help a lot. I'd like to have a little time to consider it.
Everything will be discussed, what is in the resolution. So if you don't mind, I'm going to unshare the screen for a minute. So sure. I can do it.
So Barbara, as you do that, one of the things in conversations that we've had in our previous task force meetings, we talked a lot about looking at transportation, food, health and safety, and wellness activities. And one of the things that we discovered is there's a lot of really great resources that are happening throughout Oakland County right now in regards to food deliveries, food ordering, transportation, some health and safety components, and those wellness activities, from wellness checks to different, Zoom activities that are taking place online. The idea behind this mailer is to really highlight on those resources and activities and services that are presently available right now to seniors. And so as we go forward with this mailer, like I said, the things that we really want to highlight and hone in on are those health and safety components. We heard some insight from Kathy Forsley in regards to some components to maybe look at including on the mailer to represent some of those health and safety pieces. And in addition to transportation and food delivery and food availability at our food pantries, and in addition to looking at those wellness activities that are presently taking place. So when we think about these mailers, just keep in mind that this specific initiative is to really highlight on the resources that are available right now for seniors here in Oakland County.
I have emailed both resolutions. I just want to stress out those are just drafts, so you will see a one amount in it, but it might have changed after today.
Sure. Commissioner Colwell.
Thank you, Madam Chair. In any of these, have we basically included, say, we have a senior coordinating council, am I not right? I haven't seen evidence of them being involved in this, or are they?
So I know that Cameron, oh,
Yeah.
Cameron McClure, who unfortunately is not on the call, I don't see yet
Okay.
today. He chairs the Senior Advisory Council, and one of the things that he has been providing is, and I can definitely forward this information along to the task force or commissioners in regards to the activities that the Senior Advisory Council has been doing, is doing, and is presently doing in regards to some of the resources that they're working on promoting. So in tandem with having Cameron provide some of that information through the Senior Advisory Council, paired with working with AAA 1B, has been really beneficial at taking a look at really those core categories of looking at providing information on accessing those services. That's a really great question though. But yes, we definitely have incorporated the resources and priority areas of other organizations and the Senior Advisory Council in Oakland County. Commissioner Lubes? Oh,
and then
Commissioner
Lubes first, and then I have another one. Okay.
Commissioner Cole for a second time. Thank you.
I love the idea of printed material to each senior's home. I know many, many seniors who don't have access to the internet or a computer. A volunteer and I have put up a rack with printed material at the Clausen Library and the Berkeley Library. Some of the materials from area agency, but all references senior services. So it's not just seniors, but it's their caregivers also. And that material flies off the rack. When the libraries were open, we were filling each of the racks up once a week. We've approached other libraries to do the same. Some report they don't have enough room in their library, but there's a need for the printed material to be in the hands of the seniors and the caregivers.
Excellent. Thank you for that information. And it also highlights the importance too of not only do I think it's going to be beneficial to do this direct mailing, but as you said, Commissioner Lubes, making sure that we do have enough to make sure that we are able to hand those out throughout our districts and our communities in addition to those direct mailers, because you're absolutely right. Our libraries house a variety of resources, and I know a lot of the city halls do as well. So to have that information be accessible at different locations in addition to in the mailboxes of seniors, I think is going to be really crucial as well. Commissioner Kowal.
I just wondered if maybe not in just relationship to this, but if there's been any discussion about perhaps partnering up with some companies that might be able to or want to offer resources to us that might be able to help seniors. They could, technology companies, other kind of companies where it might be easy to use technology for seniors. Just what are we looking at to partner up with to help, I guess, to help lower the cost of this? Partners that, private partners that would be more than willing to help out with this. I don't think it necessarily all has to be funded with CARES money or other government funding. So I would like to see some exploration into that avenue.
Excellent. Thank you for that information. You are absolutely right. There are going to be initiatives that we, definitely look at, work on, and strive for in this task force that aren't going to necessarily involve that CARES Act related money. Going back to just some previous conversations in the last task force, one of the first priorities is to take a look at what can we do right now, given that we do have access to that CARES money and we only have access to it for a very limited short amount of time. So I definitely hear exactly what you're saying, Commissioner Kowal, and I agree with you. But again, it's just trying to focus on those things that we can do now with the money that we do have available with the CARES Act before they do run out. So there will be many more conversations in regards to looking at partnering with other companies and local organizations for some of the other initiatives that aren't going to necessarily qualify under the CARES funds. EJ.
Just wanted to add in that real quick. One of the things I've been doing off the side of my desk is talking with AWS and the technology things that they do with seniors, and they're connecting me to some of their partners as well with things that they've done. And they're working on hopefully coming back with a presentation they'd like to share with this group of things that they could offer from a technology viewpoint, from an access viewpoint, whether it's tools or services or partnering with other people. So that is actually active with me. Just wanted to share that back with the group.
Excellent. Thank you so much. Alrighty, is there any questions, comments, or concerns related to agenda item number 1? And again, the $120,000 is going to be coming from the CARES Act Coronavirus Relief Fund money. That is money that has to be spent before the end of this fiscal or end of this year in December 31st, 2020. Yes, Barbara.
I just want to update the task force that $120,000 is based on a 5x7 postcard size that was recommended. I'm working with AAA1B on the content, and they said it will be appropriate, but if a task force seems to think that 5x7 is not big enough, we can definitely go one size higher, 10x8, or is it the proper size is 11.5 by 8.5. So if the task force chooses to go with the bigger size of a postcard or mailer, we would have to update the money appropriately.
Sure. So thank you for that information, Barbara. I know that it sounds like, so AAA1B is has recommended the 8 or the 11 by or the 5x7. Fellow task force members, what are your thoughts on the 5x7 versus the 8.5 by 11.5? I know that we talked about we need bold colors, we need bigger fonts. Commissioner Kowal?
I have no idea at this point. I'm sure there's a lot of information to get across. You could go and, doing a whole county. So I don't think it really, as far as postcards go, I don't know if there's I don't think there's a cost difference between mailing an 8x10 or a 5x7. Maybe I'm wrong on that. Yeah. It just, as long as it contains all the information that, would be helpful to the seniors. So I have no idea what size until I see it.
Okay, yeah, 40, a 5x7 is 47 cents. Hopefully we can get it lower because we will be sending it in bulk. And one more thing I forgot to mention, Commissioner Nelson wanted to make sure on that postcard where the address will be, they will be tailored to each commissioner and each district. So we are going to have 21 the same cards information on the back, but the front will be different based on the commissioner district with their information, so that the seniors know to reach out to them as well.
Absolutely. Thank you for that reminder, Barbara. And that's important because I'd like to think that all citizens know who their county commissioner is. And this way with our seniors, it does make it a little bit more concrete and gives them that direct access to somebody that they can contact and not get, a recording, that they can get directly to their commissioner for additional support on additional services that they're looking for. So thank you for that insight information. The idea is that when we do get something drafted, we will bring it back to this task force to get more insight, feedback on before we do go forth with mass printing. And again, at the end of the day, this is an initiative that is used by the CARES money, so it is something that we do have to do rather quickly in regards to making sure that everything that we're planning on doing with the mailers is obviously completed by the end of the year. But our goal is to really be able to roll these direct mailings out by next month. Given that we do have a board meeting this evening, I would like to introduce it to the board so we can get the ball rolling in regards to moving forward with these direct mailers getting in the hands of seniors ASAP. With that being said, do I have a motion to proceed with creating the mailings for the seniors?
You already had a motion, yes, by Commissioner Loop supporting by Cole. Now just need a vote.
Oh, okay. Do we do a voice vote or all those in favor?
Roll call.
Roll call. All right, roll call, please.
Commissioner Loops,
Yes.
Commissioner Cole,
Yes.
Commissioner Nelson.
Yes.
Madam Chair, something passes. I don't know what it is.
Countywide mailer with resources and services available for seniors. Thank you. Alrighty, moving on to agenda item number 2, interactive county website with resources and services available for seniors. Can I get a motion? Motion by Commissioner Loops, support by Commissioner Kowal. Excellent. Do a voice vote. All those in favor say aye, Barbara. I'm sorry?
Discussion first.
Okay, thank you.
I've not seen it.
And we
I'd
do
like
not
to see
have
it.
to vote on it. This is on
This
the
is just for
agenda.
discussion.
Sorry?
This agenda item number 2 is just open up for discussion.
Okay, thank you.
Excellent. So in previous task force meetings, we've talked a lot about that technology component. We know that there is a significant need to get seniors up to date and in the know with not only how to access devices, use devices, and then use it to find the resources. We also know that there are a lot of seniors who do already presently have access to those devices and internets. And so when we took a look at some of those short-term goals of the things that we could do to start helping increasing the knowledge of the resources and the information that is presently out there, we have previously discussed utilizing a website to have this information be on one page in an easy, readable, accessible format. And, you know, as we heard from Kathy Forsley today, that there potentially still is. I know that Kathy, if you're still on the line, if I heard you incorrectly, please correct me. It looks like there potentially is senior resource webpage attached to the county website and the health division's website. And in addition to that, one of the things that we have kind of talked about in the past is utilizing a webpage specifically for additional senior resources that are on the local level and also at the state level that are available for seniors to use. And I'm going to kind of throw this over to Mr. EJ to see if you could just share some insight on what this potentially could look like. And I know one of the questions that I did receive about this item is, what would be required to have a searchable zip code feature on the website? So seniors could literally just put in their zip code and have those services and resources that are the closest to them pop up first.
Sure. And so I've done a little bit of legwork with this, with the emails that came in, and basically there's a few different options that exist with the information that comes in. The key driver will be, we call them in IT requirements. What are the needs and the information we want to present? Is it going to be a map that filters by zip code, which it sounds like is part of it? Is there a pass-through that we want to do for other links to other resources that go in? We have to build out what that list looks like to build out the demand. But to get to the zip code feature and what we kind of looked at was, I just wanted to get a size estimate of how this kind of looks. And what we were looking at was the ability to have a find, search, and clean the addresses for the resources. And that needs to be converted into a sheet that can be loaded. We would then map the resources to search by zip, including, we could include driving directions with that. And then we could actually add this into the county's COVID, like the county's COVID resources page. And this effort to do the mapping piece is right around 30 to 40 hours of work inside of an IT thing to build that interactive map. So there's 3 basic steps. It's roughly about 40 hours, and then it's just a matter of getting it prioritized to be worked on, and that is to build it into the existing COVID response map. We could have a link added to that.
Excellent. Thank you. Do any task force members have any thoughts, feedback, concerns,
And-
anything that you would like to share, Commissioner Lutz?
I do like putting in your zip code so you can find the resources closest to you, because distance may be an issue also.
Absolutely. Commissioner Kola.
Thank you, Madam Chair. Having worked on the human trafficking task force and the web resources that we put up, I don't think it's going to be as big of a problem with the seniors, but obviously any and all of these resources would have to be, vetted. Make sure that there's no shady characters in there or any possibilities for fraud or anything like that. I don't see that as being a problem. With the human trafficking, we had people that wanted to, be speakers and do things like that, and we had to make sure that they were properly trained and knew what they were talking about. But just I thought I'd throw that out there, just to make sure that any resource is properly vetted.
Commissioner Nelson?
Yes.
Kathy again. So our web page is still up there, and this is a resource page that includes everything that you've talked about. It is something that our nurses keep up to date, and we work, we have a lot of community partners that have worked with us on this as well. We've been very careful about what's included on that web page so that it's not like advertising of, they're legitimate resources. So it's not something where we would have to question what kind of service are they providing.
Kathy, are you talking about the older adults website?
Yes.
Okay, I can share it on the screen.
Nice. So what I'm saying is there's a lot of work that goes into upkeeping and maintaining this, and we do this based on the questions that we receive, the things that our community partners are telling us are important, what our Senior Advisory Council has told us is important. The Senior Advisory Council kind of approves it as well. And so I'm just thinking that if you're, I don't want to have two senior websites out there coming from a county resource. So I'm thinking that if there are things in here that you are thinking needs to be maybe different, maybe we should talk about creating one website that we share, on both fronts, and we can utilize our staff to keep it updated and vetted. I don't know, I'm just putting it out there that it can get very confusing when you're trying to get seniors to focus on a resource page, and then, the same governmental entity has multiple pages, at different sites. I think that could be confusing.
I absolutely couldn't agree more, Kathy, that, sometimes we have to, try to take a look at condensing and not make it so confusing, especially if it's repeated information. So as we do move forward with taking a look at this agenda item, it is completely opened up for discussions, feedback. Anybody is more than encouraged to provide any feedback on anything that they would like to see within these within this web page. And definitely, we don't want to have duplicated information, because that could potentially create more confusion and actually go against the whole purpose of trying to have a resource page that's designed to have seniors be able to easily access information. The one thing that, as I even look at the things on the older adults webpage, some of the things that potentially would be, and again, I hear you when you say that things change quickly, and I think we all kind of learned that throughout the pandemic in regards to how quickly information and resources can change. And that does come into play, especially when we want this to have the most updated information. But things even like maybe there's links to, how to open up Zoom, how to, leave a Facebook comment, things that are additional to actual things and events and services physically within Oakland County.
Yep, good point.
Yeah. EJ, did you have something that you wanted to say?
No, I was just taking notes. You can.
Oh, I gotcha.
writing down stuff.
Everyone's so little.
Hey, this is Rep Manugian. Just a thought as I was listening to this. I just have a question about maybe making the website available in languages other than English. We may have an elderly population that doesn't speak, or seniors who may not speak English as a first language, and having access to it in another language would be, I think, very helpful for some folks.
I think that is a fabulous idea, and I greatly appreciate that feedback. Thank you. I see the importance in that, and especially as we look at how we can reach all seniors, making sure that it is accessible in a variety of different languages is imperative. So thank you so much.
I'm sure the website also probably is ADA compliant as well, but just making sure that when you hover over pictures, that there's a text that accompanies it, that sort of thing. Making sure that it's available to be used with a screen reader, I think, is also really important. Just making sure that it's as accessible as possible. And I know those are extra steps, but they're super important to make sure we're ADA compliant as well.
Excellent. Thank you.
I just want to point out that the Washtenaw County, they have their county website, translated to 5 languages. Everything is on their website. I don't know how they did it. And, we even look at it, with my limited German knowledge. It's not Google translated. It really makes sense. So I don't know if there's like a software or something that automatically translate, but I think they offer their county website in 5 languages.
Excellent. Thank you, Barbara. Alrighty, so this agenda item number 2 is going to be something that we are continuously going to be talking about over the course of our next task force meetings. There's going to be no action on this agenda item today, but it is going to be an item that we will continue to see on the agenda on the task force as we do move forward. Yes, Barbara.
Chair, we already have motion and support. You can vote it on it, and the motion can be that, the departments will start working on some interactive website and updating the existing websites. So if this is the pleasure of the committee, you can vote, make the initial effort that the work will be done on it.
Okay, excellent. Do I have a motion to proceed with initial efforts? Okay, Commissioner Colwell.
Yeah, I think, Kathy brings up a good point that we have this website already. So I'm not sure about how we should proceed with this. I think that this website that's existing already for seniors can have some additional components to it. I don't really know that we need another.
This is what I said. Yeah. No, I 100% agree. Yeah.
So just to clarify then, I agree with you, Commissioner Colwell, in regards to there's not any need to reinvent the wheel if we already have this information available online. And Barbara, please correct me if I'm wrong. The intent of moving forward is to have such departments, the health department, the IT department, even our senior advisory council work together and begin the start of looking at what resources are already out there and what resources are missing. I definitely hear both you and Kathy Forsley in regards to there's a lot of really great stuff out there. I don't want to reinvent that wheel, but I think that having these initial conversations of departments working together, we're going to learn what information is missing. And that's the most important component to this initial investigating and working together with different departments, is figuring out what don't we have. And I think the first way to do that is to take a look at what we do have. Does that make sense?
Yeah, thank you for clarifying that.
Yeah, no, absolutely.
That makes sense to me too.
Okay, excellent. So, before we move then into looking at making that vote for the next steps, is there any departments other than our health department, our IT department? I know AAA 1B is already working with us, looking at our senior advisory council. Can you think of any other departments at this point? And like I said, it could change tomorrow with having another department added in. Commissioner Kowal.
I think maybe because seniors are subject to, unfortunately, a lot of scams, that maybe we should be working with the sheriff's department, law enforcement, or whatever to have a component, anti-scam type of component.
Prosecutor has quite a program on that as well.
Excellent, thank you.
Maybe we could make a link to that as well. So
yeah, and Parks also has a tremendous amount of senior efforts that we work with them on, and I think they have a lot of things that they might add a lot of value.
Excellent, thank you. Commissioner Lubes.
I don't know if it's possible that we're able to work with Honor Community Health or Beaumont's expressed an interest to be a community partner in some kind of capacity. I don't know what role they play or what information we could put on regarding additional health services also.
I think I would love to further looking at how we can collaborate and partner with Honor Health and Beaumont. I know that in previous discussions that we've had when it came to looking at telemedicine, unfortunately, one of the biggest barriers right now to telemedicine is getting devices and technology and wireless connections into the hands and homes of seniors. But I definitely do see a huge need to make sure that as we do move forward with that telemedicine component, that we will need partners and some time collaborating with other entities such as your Honor Health and Beaumont. I think that's a great suggestion. Thank you, Commissioner Lubes. All righty, Barbara.
I think MSU Extension can be also valuable with their nutrition and other stuff. But now it's getting old. How big the website will be.
True.
Well, and a lot of times too, I mean, having just these links that are, available that, specifically spells out what exactly is on that website. So I think that, it's one thing to go to all these different websites is one thing, but having all of these websites condensed in a hyperlink format that just allows an easy click and then transition right into that website. Barbara, did you put up the Oakland County Senior Resource Directory?
Yeah, so it was just one of the links that it was there, but when I looked at it, it's like 70 pages. But I think they are, they are active pages, active links. Oh, no, I don't know.
Thank you.
Maybe something like that would be, I don't know how to get out of it now. Oh, yeah.
Excellent.
So maybe just, something like that would be feasible.
Excellent. Thank you for that. So to go back to agenda item number 2 and looking at, do I have a motion to proceed with working on and collaborating with the different departments across Oakland County to look at how we can make sure, A, we're not duplicating information on the website, but also trying to find out what information do we need that's not out there yet. Alrighty, can I get a motion? Motion by Commissioner Lubes.
I'll support that.
Excellent. Thank you, Commissioner Cole. Support by Commissioner Kowal.
We need to roll call vote. Commissioner Cowell?
Yes.
Commissioner Nelson?
Yes.
Commissioner Lubes?
Yes.
Thank you, Madam Chair. The motion passes.
Excellent. Thank you so much. All right, moving on to our third and last agenda item. It is grant program application to support public senior centers across the county. Do I have a motion? Motion by Commissioner Lubes. Support by Commissioner Kowal. So Barbara, can we put that, can you hide that for a quick second? I want to give some preface and background before we go into it. Thank you. I know it can be distracting. So one of the biggest pieces that we've taken away from this task force so far is taking a look at our seniors across multiple different senior centers in Oakland County. And thank you to Cameron McClure, who provided us with an updated spreadsheet of the senior centers across Oakland County. And there's roughly a little bit less than 40 senior centers across Oakland County. And in our previous discussions, we have talked about the extra costs that senior centers have been having to put forth in regards to the COVID-19 pandemic. We've heard that increased services of their social work services, doing their reach out to seniors in their homes throughout March to even presently taking place now. We've looked at additional costs of training for staff to keep themselves safe, the senior safe and employees safe, looking at infrastructure that was needed in regards to increasing that social distancing and trying to protect that space as much as possible. We've also learned about the technology expenses. For a lot of our senior centers have tried to move a lot of their programming online and in digital formats. So think of like your Zooms and other meetings and formats that are taking place online. And in addition to your food, your, there is additional transportation costs that have been, burdened to senior centers that wasn't expected. So in regards to the conversations that we've had about what we can do for our senior centers across Oakland County, this resolution that, Barbara, you can put it up now if you don't mind. This resolution is essentially saying that utilizing money that was already put forth with our CVT community partnership grants, that up to $2 million would be available for senior centers to apply for coronavirus relief and expenditures that were specifically spent due to and during the COVID pandemic. One of the pieces of information that we've heard a lot from task force members is that we wanted to create the resolution that allowed for a more flexible, broader opportunity for senior centers to be able to submit for reimbursement. There's a lot of really great things taking place across senior centers in Oakland County, and not all of them, needed to spend, the same amount of money on, PPEs, same amount of money on, looking at sneeze guards and looking at dividers or technology costs. So the intent of this resolution was to be broader, just so we could have more items and services be captured under this grant. So, Barbara, is there any way to make it bigger so we can see all of it at once?
It will be either bigger or you can see everything at once. But I emailed it at the beginning of the meeting to everyone. So if you go to your emails, it should be there. I just, so here is just the beginning is just the need and pointing out how senior centers are important. And then the second part of the resolution is how it's going to be financed and what are the priority proposals. So I think this is the most important part of the resolution. If you can look at the priority proposals and if those are good, or would you propose some changes?
Commissioner Lukes?
I think it's fine.
Oh, I'm sorry. I thought you raised your hand.
Oh.
So the structure of this resolution and grant proposal is very similar to other grant structures and proposals that we've already put together over the course of the past couple months. Again, we've learned some things along the way in our grant process, utilizing the COVID CARES money, and we're continuously learning more. However, as we move forward with this grant proposal, one of the things that we wanted to make sure that we captured in it was the possibility of doing another round. As I said, each senior center has their own needs and their own budgets and expenditures that they've, already paid for X, Y, and Z over the past couple months. So not everybody, not all senior centers are going to utilize all up to the $50,000. So if we do have the opportunity and have additional monies left over, then what we did, similar to our small business grant mobilization grant application, was that we did a second round. So if there is additional monies left over, the $2 million, most certainly we would like to open it up again for another round of grant applications. Is there any questions, comments, feedback, EJ?
One question, and this may be too low level at this point, but how are we going to do the awards? Are we going to plan to use that small business grant application and to process the payments and everything else like we did before? Would we be building like a different app to do that, or is it going to be manual?
Can you say that first part, EJ? It cut out on me. I'm so sorry.
Sure. I was asking if for the award process for these grants, are we going to use the grant application that we use for the small business grants? Or are we going to build a different thing, or is this just a manual disbursement that we're planning for?
So that's a really great question. And Barbara, please correct me if I say this incorrectly. The process that we would be looking at for this grant is it would go over to our, Barbara, what is the committee called?
So it's Oakland Together Local Government Partnership Oversight Committee, because a couple weeks ago, or I don't know, sorry, a couple days ago, I don't know, Board of Commissioner approved, I give it a working number, the 35 million, working title, $35 million for CTV's grant. And this senior center grants is included in the $35 million. And the structure is already created by a county executive. At the last board meeting, there were already even two memorandum of agreements with the community. So I think they will take it over and they will, follow the Oakland Together Local Government Partnership way of dispersing money and apply the same to the senior centers.
Okay,
Sure.
Thank you.
And so, EJ, that's a really good question, because I do know that the small business mobilization grants was one of our very first grants that we had drafted, designed, and opened up in light of the CARES Act money. And through that process, we learned a lot. There were some barriers along the way when we first initially opened up that grant. And then there was obviously additional barriers when we opened up that second round. So the good news is we've learned a lot since that first grant proposal and resolution. So I say this because one of the bigger barriers that we had was getting that money out in a fast, prompt time. And so we learned that along the way, when we created those grant applications, we now know that there are certain questions that we will make sure are included to help expedite depositing the money out with those awardees, because that was one of the things that we learned with that specific grant, that there was information that we could have put in the grant application that would have expedited the disbursement of the monies in a quicker, prompt manner. And since then, we've also made sure that we've included those things in the grants that we've done after that. And this most certainly is not going to be any different, and it'll have that information in too.
Okay, thank you.
Yeah, thank you. Is there any other additional questions, comments, feedback, concerns?
I have one, and you may not even be able to help me with it. This is Kathy. Every week we have a call with all our long-term cares, independent livings, senior centers, and every week it's the same issue with senior centers who are misinterpreting governor's orders, which, you know, on no fault to them at all. I know it's confusing, but, you know, if the governor is saying you can have gatherings of 100 outside, you know, they're wanting to bring seniors in and do their outside exercise classes, and we're really trying to walk them through this, that, you know, this is a very contagious disease. This is something that once you start to bring seniors in, even though some things are technically allowable, you're really adding a lot of risk by holding things outside. And you certainly can't be doing anything inside, except we've told them that one-on-ones should be allowable, depending on what it is. The whole point that I'm trying to drive is that I think when we offer them an opportunity to work on things like their reopen plans, which is all phenomenal, I totally support it, and talk about PPE that allows them to safely reopen, I'm hoping that there's some kind of language that goes out with the application that just because they may complete some of these things, it doesn't necessarily mean it's safe to open. And I wouldn't even know, I'm not pretending that that would be the right language, but I don't want them to think that they have cleared an obstacle and now they can open because they've conducted this work, which is very important work to do, and they are positive steps forward. But in the reality, if our cases are climbing right now, these centers may not be open for a very, very long time. But they don't see it that way, and I don't want to make them think that they're necessarily doing some things here that will change that.
Okay, well, I appreciate that feedback, and I definitely find value in that in regards to just because you can doesn't mean you should, and it's all about that education component. And I definitely have noted the information that you shared, and as we do look at having that committee work on that application, I will convey this information because it is important. So thank you, Kathy.
Sure, and if there's anything I could ever help with, I'd be happy to. And even if it's to provide some feedback on the applications, because I'm going to be talking to them every week anyways, and some of that work could be a topic for what we're talking about there too.
Sure, absolutely. I definitely think that that would be helpful. And just given that you said you remain in close contact with them throughout the week, so you have a definite good platform to be able to help convey these kinds of things when it does come for the application. So thank you. Is there any other questions, comments, concerns on agenda item number 3? Okay, very similar to the agenda item number 1, we're obviously utilizing the COVID relief money to help with this initiative. So with that being said, it is one of those resolutions that we would like to act on quickly because we do have a very specific time frame in which this money can be utilized. Kind of as Barbara already highlighted, that the money, the $2 million to help support our senior centers across Oakland County is the pot of money that is coming from the CVT community partnership resolution that was previously created, almost a month ago now. So the idea, as with agenda item number 1 in regards to the direct mailing, is to take this resolution and introduce it at our board meeting this evening at 5 p.m. to begin getting this ball rolling so we can get this information and grant application created, developed, and out to the public for people to begin, for our senior centers to begin applying for ASAP. Any additional questions or comments, concerns? If not, is there a motion to proceed with this resolution? Okay.
We just need a roll call.
All right. Roll call, please. Barbara?
Commissioner Nelson,
Yes.
Commissioner Loops,
Looks
I
like
see
she's
your
giving
time.
us a
Yeah.
thumbs up.
Sorry, took a minute to unmute.
I saw it, yeah. Commissioner Cowell,
Yes.
Madam Chair, the motion carries.
Excellent. Thank you so much. As we move forward, one of the things that we're going to bring back is obviously item number 2 in regards to looking at some of the information that we've discovered from looking at what resources are not presently out there on the websites and organizations and departments within Oakland County and across Oakland County. But one of the other things that we will be talking about in the very near future is taking a look at some of those long-term goals and priorities, and one of them being technology component. There's, even though we're not necessarily talking in specifics about technology devices and wireless connectivity, there's a lot of things transpiring behind the scenes in regards to reaching out to internet providers, looking at trying to create partnerships with other local organizations as well as national organizations in regards to what is the easiest, best, cheapest, cost-effective way to get technology and devices into the hands of seniors across Oakland County. So as we do move forward in our next task force meeting, what I will do is we'll bring an update on where we're presently at with that. And given that more times than not, the internet accessibility, there is still some information that we're trying to figure out in regards to being COVID related reimbursed. But as far as the devices for seniors, we're pretty confident at this point that the CARES money does not cover that. However, just because the CARES money doesn't cover that does not mean that we're still pushing forward with that initiative. So I want to thank everybody for their time today. And I'm thinking, Barbara, that to have our next task force meeting slated for July 16th.
Okay.
Commissioner Loubs and Commissioner Colwell, does July 16th?
Let me check. Probably.
Looks good right now.
Commissioner Loubs is checking. I just want to tell everyone that once we have a draft of that postcard, it will be sent to all of you for your input. I just, it might be a really short period of time. I'm working on an election card right now for a different group, and we have like 1 day. So if you wouldn't mind, I am going to, once it's designed and, I will send it out for the final input, and then I will just ask for quickly reply.
Excellent. Thank you, Barbara.
Thank you. I wrote it in my calendar.
Excellent.
Awesome. So on Wednesday, we're going to find out how much money there is in the Oakland County budget. And on the 16th, we're going to try spending it.
You're right, it is budget season, but it's a really great time. There's a lot of difficult conversations that we are going to start and have. So I know that as we do proceed forward with budget discussions, the technology and device component is something that is going to be discussed during that time. And just as the time shall have it, this is going to happen within the next 2 weeks. So again, I greatly appreciate everybody's time today. And if there is no further business to come before the meeting, without further objection, I declare the meeting adjourned at 12:36.
Take care,
Thank you,
everybody.
Thanks, everybody.
Thank you. Have a safe weekend, everybody.